What is a critical incident stress management, CISM, program, and how does it work? Have you ever wondered how organizations help their employees cope with traumatic events? Critical Incident Stress Management, or CISM, is a structured program designed to provide psychological support and crisis intervention for those exposed to traumatic incidents. These incidents can lead to intense emotional reactions and, if not addressed, may contribute to post-traumatic stress disorder, commonly known as PTSD. The main goal of CISM is to reduce trauma-related symptoms and support recovery. It acts as a form of psychological first aid, helping individuals process trauma in a supportive and non-judgmental environment. So, how does CISM actually work? First, CISM emphasizes pre-incident preparedness. This means training and educating individuals, especially those in high-risk jobs like emergency responders, before any traumatic event occurs. By equipping them with resilience tools and knowledge about stress reactions, CISM helps lessen the impact of future incidents. Next comes acute crisis management. Immediately after a critical incident, CISM employs various intervention tactics tailored to the situation. These interventions can be delivered individually or in groups, addressing the immediate emotional and psychological needs of those affected. After the initial response, CISM provides post-crisis follow-up. This ongoing support ensures that recovery continues and helps identify individuals who may need further professional mental health services. One key component of CISM is Critical Incident Stress Debriefing, often referred to as CISD. This is a facilitator-led group session that occurs soon after a traumatic event. It typically involves sharing facts, thoughts, and emotional reactions, discussing symptoms, and educating participants about stress responses. This process encourages sharing experiences and promotes group support, which can help identify those who may need additional help. CISM also relies on peer support. Trained peers who have undergone specific CISM training provide support to their colleagues. This peer-driven approach fosters trust and understanding, as they can relate to the trauma faced. The interventions in CISM are tailored to the nature of the incident and the individuals involved. Some may be brief and focused on one person, while others may involve larger groups. CISM is widely used among professions that regularly encounter traumatic events, such as law enforcement, firefighters, emergency medical personnel, and military members. These groups often face distressing situations, including line-of-duty deaths and mass casualty events. However, the principles of CISM can be applied to anyone experiencing traumatic stress. CISM plays a vital role in preventing PTSD by offering early intervention. By providing education, emotional support, and coping strategies shortly after trauma exposure, CISM helps individuals process their experiences effectively. This early support is crucial in workplace trauma settings, especially for first responders who frequently encounter traumatic events. In summary, a CISM program is a comprehensive approach to managing the psychological impact of critical incidents. It works through preparedness, immediate crisis intervention, and follow-up support. By employing peer support and structured debriefings, CISM helps individuals and groups recover from trauma and reduces the likelihood of long-term PTSD. If you or someone you know is dealing with trauma, seeking professional help is always a good idea.